Hi guys, so following on from a brilliant hour on UKRunChat last night, just wanted to spend a bit of time and elaborate on a few questions to give you a little bit more information and hope we can help you progress along a little bit more quickly with the information that we provide. So first up, Matt Thomas, thanks for your question last night. You asked about runner's knee and asked about the fact of, is there a simple way of getting yourself better more quickly? The simple answer, Matt, is no. It takes a lot of work, and especially with the area of the knee, there's a lot of forces that go through the knee and factors that contribute to the pain. So first thing to remember about runner's knee is if we focus on the patella, which is the kneecap, what we're aiming to do is try and keep this in a nice straight line and allow it to work up and down to be able to fit into its groove underneath. Often, especially with runners with poor glute control or core stability, the kneecap can be pulled out to the outside and the irritation starts to become apparent in the knee. What you can often get is pain deeper seated into the knee or pain onto the tendon itself. All of these can fit into the patellofemoral pain syndrome bracket or the runner's knee. Okay? So things we need to do, Matt, first of all, let's focus on your glute control, okay? So we need to make sure that your glutes are really active and able to support your knee, keeping them in a straight line, okay? So I'm going to give you an exercise now to help that. So, into side lion, you're going to make sure that the line of your heel goes through your buttocks, okay? You bring your knees up nice and bent. And you're going to pop your hand on where your pocket would be in your jeans. From there, you're going to slowly keep your heel planted on top of the other heel and bend this knee up as far as it can go. Take a minute as what you feel can be at the top and extend a little bit further on an out breath. Slowly return down to halfway and then return again going upwards. Again, it's really important to focus on getting to full range and making sure that you don't start to open out through your lower body into that motion. It's making sure that you're nice and straight on top of your hips, on top of your knees, and on top of your heels. Look to do that around about 3 lots of 8 times. And do it on both sides so you're actually preventing injury on the other side. Another key thing to focus on with runner's knee is looking at the flexibility and mobility around your hip and pelvis. Everyone loves a foam roller or a massage tool. Here's my handy ball, and what we'll be looking to do is offload the TFL, which is a muscle on the side of your leg, but also feeding down the ITB into down on the other side of your knee, on the outside. Okay? So quite simply, you're placing the ball onto the floor, and you're positioning your pelvis on top, and you're having a little roll using your body weight all on the outside of your hip to try and find any tender points. Once you find a tender point, just slowly roll over that area for around about 1 to 2 minutes. And again, this is important to do on both sides because you'll be actually preventing the injury or helping to reduce the risk of the injury on either side. My one final top tip is to make sure that the knee strength is as good as it possibly can be. So as I've said, often you overload the outside of the knee joint and the muscles on the outside are a lot stronger than the inside. There's a key muscle involved in this as well as the glutes, and it's called the VMO, the vastus medialis. This is the smaller muscle, often called the teardrop muscle, on the inside of your knee, and it has a key role in stabilising the knee. Okay, so I'm going to give you an exercise for this using a handy step. This can be done on a staircase at home, a step outside, anything where you can take your body weight down. Okay, so we'll show you this one now. So starting up onto a step, you can get a little bit of support if you want through a pole or anything by the side of it, or a banister for example. You're going to slowly descend, keeping your knee in a straight line over your toe, and slowly come up, okay? Really focus on the knee being in one straight line, over the big toe, and slowly back up again. That'll really start to build stability and strength in the knee and hopefully alleviate the pain of your runner's knee. I hope that helps. Obviously, if the pain continues or you feel that the mechanisms or symptoms are getting worse, please feel free to contact myself or a local physio and we can help further. Thanks.